In the midst of the beauty of the Midwest, residents who come to Eau Claire will find a family medicine residency program on the cutting edge of technology with state-of-the-art training facilities. At the Virtual Medical Center, residents can learn how to handle real-life emergency situations with multiple or single patients.
We have one patient who just came in now. He's a 43-year-old male with some chest pain.
The simulated patient actually talks to the residents.
Oh, I'm starting to feel worse, Doc.
Okay, are you a smoker?
Faculty can manipulate the patient conditions and reactions
My stomach's upset.
based on how the residents respond.
Right at first, it's the mannequin, you're just kind of going through the sequence, and then all of a sudden you get into the mode, okay, here's what I'm supposed to do next, and here's what I'm supposed to be anticipating. You just forget that it's any different than a real patient.
In this simulation, the residents fail to take a drug history and give the simulated patient nitroglycerin. As a result, the blood pressure drops.
Looks like we got VFib. We need to call a code blue.
Code blue, ER, room 3.
Check a pulse here. Start an airway. I don't have a pulse. Can you start chest compressions?
It offers us an opportunity to actually put people together that normally don't get to train together and to work to each other and then talk to each other about it. So how did that feel?
In a debriefing, the participants go over what went right and what went wrong.
What do you think Ellen would have said had you done a drug history?
Ah, okay.
Oh.
Okay, so he probably had Viagra or some type of medicine like that on board.
I did take Viagra last night.
In rural places, often people don't get enough experience doing codes, evaluating patients who've been through a trauma. This gives us an opportunity to schedule a code that we can participate in and get comfortable with it.
The Virtual Medical Center is just one piece of a family medicine residency program that has always pushed the technological envelope. The Eau Claire Family Medicine Clinic is a state-of-the-art facility that was one of the first in the nation to have paperless medical records.
As a residency, we see our job not to teach for today. It's relatively easy to teach a resident what they need to know to be a good doc on the day they graduate. We want to teach them for their practice for the future. And that means that we need to be a great example of what's coming.
The program may have big city technology, but residents can expect a small town, caring atmosphere when working with faculty and attending physicians.
In a larger city, you kind of get the sense that you do a lot of the work without any reward. And in here, you get treated more as a colleague. Private attendings will call you and cooperate on patients with you rather than just calling your attending and skipping over you. So you're more involved in the patient care, I feel, than you would be in a larger setting where there's more residents to compete with.
The faculty will kind of gauge how good your plan is. Usually they tell right off, oh, this got a good plan, or he knows what he's doing, I'm not going to change too much, I agree with it, it's not bad, it's good for the patient. Sometimes they'll be like, okay, he's got no idea what's going on, and he needs some guidance.
Residents will also find that Eau Claire is a great place to live. Russ Durkee and Binu finished their residency and decided to stay here.
Eau Claire is what I consider a perfect community. It's definitely has a small touch feel without being so small that we don't have the amenities.
It's a small town area, but with the university here, it doesn't feel like a small town. It feels like more of a little cultural rural center.
Cost of living is reasonable. Pretty much any direction you drive in 15 or 20 minutes you are out of town, and I like outdoor activities. The community is very family friendly. Schools have a good reputation. It's safe.
Most important, when residents graduate from the program,
So she was still in great shape.
they feel ready to go out on their own.
I feel very prepared. I mean, there's pretty much not a situation that I don't at least know how to start working up, or at least start evaluating to know at least where to send it or to take care of it definitively.
This year will be my 13th class that I've seen graduate. Many of them are in the community or nearby communities, and by and large, they're all successful, well-respected physicians, and we just don't hear ill things about them. It's pretty cool.